In the meantime, if you're just now joining us, pull up a chair, pour yourself another cup. Let's get to know Dr. Clarisa Smith with Yavapai Pediatrics. Dr. Smith, tell us about Yavapai Pediatrics. When did you open? How's your practice doing?
Well, thanks, DJ. I'm so excited to be here and talk about Yavapai Pediatrics. It is obviously very near and dear to my heart. I started Yavapai Pediatrics 3.5 years ago, and we have been growing exponentially. It's a busy practice. We do pediatric care from ages 0 to 18. We love kids and take care of kids all day long.
And because we have so many veterans in Arizona, you have a special connection with veterans, don't you?
I do. I served in the military, in the Air Force. I completed residency in Tucson and then went on to Travis Air Force Base in California, where I was a pediatrician there. After completing my 4 years of duty, I went into the private sector and moved here to Prescott Valley. And like I said, 3 years ago, started Yavapai Pediatrics.
So tell us what you do to make the kids look forward to coming to see the doctor.
Well, you know, coming to the doctor is a nerve-wracking thing for most children. Some are too young to really understand what's going on, but we try to make it a warm and friendly environment. My staff is amazing. They are just fantastic. They always have a smile on their face. They're always being conscientious of the nerves that the kids may have or what they do. We try to make the environment fun and interactive and short. You know, we try not to make parents wait. We keep things efficient so that you're not in the doctor's office for hours.
You mentioned your staff. You have a new addition. Tell us about your new addition.
Well, we do. We have Haley Fernandez de Cordova. She's a pediatric physician assistant. She'll be starting with us next week, actually, so we're excited to have her.
Now, when you treat a child for the first time, a brand new patient, walk us through that first experience for the child and the parent.
Well, currently, it's myself and Miss Kristen Glennon, who's a pediatric nurse practitioner, and so they'll make an appointment with either her or I, and next week, starting with Miss Fernandez de Cordova, and they make that appointment. We bring them in, they complete new patient work, and then move forward with kind of just getting to know the staff and getting to know me and addressing their concerns. Sometimes they're coming in for routine well-child visits, and sometimes it's because they're not feeling well. So again, we try to make them feel comfortable in a new setting.
And speaking of the well-child visit, vaccinations have been a big story for about a year now nationally. Tell us your take on vaccinations, their safety, and how effective they are.
So vaccines, I feel, are a very safe and effective way of preventing very serious diseases. You know, they also prevent death in certain cases. I mean, some of these diseases are very scary. Vaccines and vaccine hesitancy has gotten a lot of media lately. Because of, I think, some concerns that parents have in terms of not knowing exactly what's going on. First of all, I encourage parents to educate themselves, but I also encourage them to educate themselves in evidence-based medicine that has the facts. Like I said, vaccines are safe. The vaccines have been studied for decades before they're actually put on market and actually used in our offices. Vaccines prevent illnesses that can be spread by direct contact, by talking to someone. Some of these illnesses are contagious even before we have symptoms, and so we don't even know we're spreading them. I think that it's very crucial for your children and for you to be vaccinated, so that way you can help prevent the spread of that. There are people in our community that can't be vaccinated. They have illnesses, they're undergoing chemotherapy for cancer, and we need to be able to protect those people.
And speaking of vaccinations, tell us about the phenomenon of herd immunity.
So herd immunity is the understanding that a certain percentage, which we believe once we get 90% of the community vaccinated, that it then eliminates the risk of that disease in that community, or I hate to say eliminated because I don't want to be definitive, but it significantly reduces that risk and then protects those around us. Some people depend on herd immunity for legitimate reasons. Like I said, they're sick, they cannot get vaccines, they're undergoing chemotherapy, but other people expect others to get vaccinated, and then they'll just kind of leech off of that herd immunity, which is unfair to the vast majority of people. We will help get everyone, as many as we can, vaccinated. But if we don't get everyone involved that can and is healthy enough to get those vaccines, then we cannot achieve herd immunity.
Now, tomorrow on Sandy and Friends, we're going to have Scott Shepard from the Humane Society, and he has told me before, I wish our little furry friends could talk to tell us what's wrong. You have little human beings who sometimes are too young to be able to verbalize what's wrong. So how do you diagnose it?
That's a really good point. A lot of our kids don't talk. They can't tell us what's going on. And obviously through my training, it's part of how I have been able to diagnose and treat young children that can't tell what's going on. I rely on parents. Parents are so crucial in giving me history and telling me what's been going on. And then I look at the child. The minute I walk in a room, I'm watching a child. I always tell parents they may be sick, but they're not necessarily ill. Kids that are having fevers, cough, and they're running around the room, playing, messing with things, crying, getting mad at me. Those kids are appropriate. I pride myself to say when I walk in a room, I can tell you when a kid is sick. And there's times when you walk in a room and someone's just looks bad, and that's when you can tell. So a lot of it has to do with just their demeanor. But again, we do a thorough exam. I've done a lot of training. I continue to do training, ongoing conferences, ongoing education to myself to make sure that I stay abreast of the most recent recommendations and how to diagnose and treat my patients.
Speaking of training, when you have a new couple who's expecting their first child, this can be a very scary experience. Do you do prenatal training or counseling?
We do prenatal visits so that they can come in, see the office, meet the staff, meet me, and ask any questions they may have. In terms of prenatal training, we encourage parents to take it one step at a time. It's very important to read your books and to educate yourself, but one step at a time. So at each visit, we provide parents with a vast amount of information that's specific for that age group. We're not going to talk about potty training at the newborn visit. That's a little premature, but we are going to talk about sleep and colic and rashes and spitting up and so forth. And then at each visit, at each well visit, we continue to do that.
And how can people contact you at Yavapai Pediatrics?
Well, we're in Prescott Valley in the Entertainment Center right near Harkins Theaters. Our office number is 928-458-5470. And of course, we're on the web at yavapaipediatrics.com.
That's